Welcome back. In the last video, we looked at the 4 parts of a focused clinical question. Now that we know how to compose a question, let's look at the types of clinical questions. This is an important step because it will help you with both the search and the appraisal process. The most common types of clinical questions are therapy, etiology, diagnosis, and prognosis. Let's start with therapy. Therapy questions ask what can be used to treat the problem. These interventions include drugs, surgery, behavior change, for example, dieting and exercise. So let's say a patient is getting fillings and the patient is feeling uncomfortable because he doesn't like to have pain or has low pain tolerance after the fillings. If the clinician has the choice between white fillings and silver fillings, the complete PICO question might be, for example, will adults with white fillings, when compared to silver fillings, report less sensitivity after therapy? In this case, the problem is therapy related because we are concerned about the best way to offer treatment that recognizes the chief problem of the patient, in this case, pain. As you'll notice later throughout this video, there is a difference in the words between a complete PICO question and the terms you use when searching for clinical trials. We'll talk more about this later. Moving on, we have etiology questions, which are concerned with causation. These questions ask what causes X, Y, or Z. For example, in a scenario where a systemic disease is identified, the patient thinks it was caused by the white fillings that they had several years ago. The PICO question for this might be, are adults with white fillings, when compared to adults with silver fillings, an increased risk of systemic disease? The PICO questions can also be in the form of a diagnostic question. These are concerned with how good are tests at determining whether a patient has disease. What are the appropriate tests to run, and how do we assess these tests? The options are weighed along several variables, like precision, expense, safety, patient comfort. For example, while testing for oral cancer in an adult patient, you might have 2 diagnostics, DNA testing and a visual exam by a clinician. The PICO question here is, for adults, will DNA testing, when compared to visual office exam, result in more accurate oral cancer diagnosis? We can say this test is concerned with diagnosis because primarily we're interested in comparing the specificity and accuracy of 2 different diagnostic methods. Notice here one of the terms we suggest using in the search is accuracy, not more accurate. Adjectives like accurate and modifiers, nouns and verbs, aren't included in PubMed searches. The 4th primary question type relates to prognosis. These questions have a long-term focus. They ask what can be the outcome of therapy of treatment over a long period of time. Let's say a patient is getting fillings, is concerned with how long they'll last. With 2 options, silver fillings and white fillings, they want to know if one is more durable than the other. Here, the PICO question is, for adults, do silver fillings, when compared with white fillings, have a greater longevity? The P here is adults, but it could be children or teenagers, or it can be everyone. In these cases, we tend to think of the P or population in the question as being silent because it covers everyone. Also notice that altogether the adjective longer is out of the question. We don't need it in our search. It's an adjective which we want to avoid. More on this later. Alright, so those are the 4 primary categories of PICO question. Therapy, etiologist, prognosis, and diagnosis. Let's go back to Aunt Karen and the PICO question we developed for her at the end of the last video. Knowing what we know now, what type of question did you compose?